My name is Will Longinetti, and welcome to our Tribal Opioid Response Grantee Orientation webinar for new grantees. Some of you may be new to the program. I think we do have a few tribes and organizations that haven't received TOR funding previously, but others I know, this will be, maybe your second or third time with us. So we're happy to see you all today. I think the administrator, conference admin, just announced that the meeting will be recorded. We'll open up the lines after each section for questions, but you can always ask questions in the chat box in the meantime. But I'm just going to turn it over to Kim Beniquez, who's briefly going to lead us with some introductions.
Thanks, Will. As Will mentioned, my name is Kim Beniquez, and I work in the Office of Tribal Affairs and Policy. I'm going to briefly tell you about our office, but I'm going to turn it back to the government project officers to introduce themselves.
And yes, hello again. And so I'm a project officer in the Office of Tribal Affairs and Policy and a public health advisor, and currently working with TOR grantees and tribes in the Bemidji, Great Plains, Oklahoma, Phoenix, Portland, and Tucson areas. So now I will let Brittany introduce herself.
Hi, everyone. Good afternoon. I'm Brittany Barber-Alexander. I'm also a project grants officer here, too, and I'm covering the Great Plains, Nashville, and Phoenix area. So good to see some familiar names on this call here. And if I haven't already met you, look forward to meeting you soon. Paul?
Yeah, I'm Paul Kalsbrunner, the newest GPO, been here about 6 weeks. And my areas I'm covering are California and Alaska. And I've met some of you at this point, but looking forward to meeting the rest of you over the next couple of weeks. Thanks.
Thanks, Paul. So as many of you know, SAMHSA is the federal agency responsible for the behavioral health of the nation, and that includes our tribal citizens. SAMHSA respects tribal sovereignty and the government-to-government relationship we have with tribes. Our Office of Tribal Affairs and Policy is the point of contact within SAMHSA for tribes, tribal organizations, urban Indian organizations, and other stakeholders on the issue of tribal behavioral health. We support activities within SAMHSA to improve tribal behavioral health, and our office leads tribal consultation and outreach to stakeholders, including our Tribal Technical Advisory Committee. So, Will, I'll turn it back to you.
All right, thank you, Kim. So here's a brief overview of what we will be discussing today. So for the first portion of the webinar, we'll be giving you an overview of the TOR program and the expectations, SAMHSA's expectations on the TOR program. And then we will hear from our grants management specialist, Olivia Klein Thomas, about the grants management or financial expectations on the grant. And then lastly, we will hear from Humberto Carvalho about the Technology Transfer Center Network and some of the other training and technical assistance resources available to grantees from SAMHSA. So, the purpose of the Tribal Opioid Response Grant is to address the opioids crisis in tribal communities, and we do that by increasing access to culturally appropriate and evidence-based treatment, including medication-assisted treatment, particularly using one of the 3 FDA-approved medications for OUD, methadone, buprenorphine, and naltrexone. And one of the more recent additions to the TOR grant is that grant recipients can use funds to address stimulant use, including cocaine and methamphetamine. And the intent of the grant is to reduce unmet treatment needs and opioid overdose-related deaths through treatment, prevention, and recovery support services. And here is an updated map of our current grantee locations, just to give you an idea of where folks are located. And we will be sharing these slides after the meeting today, so you'll have a chance to look at this more closely. So, TOR expectations. SAMHSA expects that grantees will develop and provide opioid misuse prevention, treatment, and recovery support services to address opioid abuse and overdoses within tribes. Tribes are also permitted to use this funding to address stimulant misuse and stimulant use disorders. SAMHSA intends that its services programs result in the delivery of services as soon as possible after the award. At the latest, award recipients are expected to provide services by the 4th month after the grant has been awarded. So this is a common requirement across SAMHSA grants that you should be providing services by the 4th month of the grant. So let us know if you expect to have any issues with that, but if you plan to provide treatment, counseling, medication-assisted treatment, we ask that you have that going by month 4. And the key personnel for the TOR grant is the project director. That's the one position that we consider key personnel, and they should be involved at least a 0.5 FTE level of effort. And ask your project officer if you have any questions about that. And the project director should be making a substantial contribution to the execution of the project and also serves as the main point of contact with SAMHSA. If you plan to change the project director, that's something that requires prior approval by SAMHSA. TOR required activities. You must use SAMHSA's TOR grant funds primarily to support evidence-based prevention, treatment, and/or recovery support services as described in the funding opportunity announcement. All TOR grantees who receive more than $150,000 per year are required to prioritize the delivery of MAT services. Grantees are expected to select activities from the list below on which your program will focus. So I know it's a little strange, but you don't have to do all of the activities that we're listing here, but you have to select some activities from this list that you will focus on. So the first is to complete a strategic plan based on the most current epidemiological data for the tribe to address the gaps in prevention, treatment, and recovery identified by the tribe. Strategic plans should be completed within 60 days of award, and you may use existing plans and build on those plans if they are available. Second thing is, did I skip another slide? Okay. The second required activity is to implement workforce development activities to ensure that individuals working in tribal communities are well-versed in strategies to prevent and treat opioid misuse. So I know a lot of folks are doing really good workforce development activities. This could include, trainings on any number of evidence-based practices. A big thing that folks are doing are naloxone trainings. The next activity is to develop effective prevention strategies, including but not limited to elder education, outreach, and engagement of youth, strategic messaging, and community prevention activities. To develop strategies to purchase and disseminate naloxone and provide training on its use to first responders and other tribal members. To implement service delivery models that enable the full spectrum of treatment and recovery support services that facilitate positive treatment outcomes and long-term recovery. And as we mentioned before, programs should be using evidence-based treatment models, including medication-assisted treatment. We also require or ask folks to implement community recovery support services, including peer recovery supports, recovery coaches, recovery housing. Individuals in recovery should have a meaningful role in developing the services used in your program. Another activity is to provide treatment transition and coverage for patients reentering communities from criminal justice settings or other rehabilitative settings, and also to assess the impact of the grant. I know many projects are, contracting with universities or other teams to do evaluation work. Now I'm going to turn it over to Brittany Barber-Alexander, who's going to talk a little bit about Tor Allowable Activities.
Hey, can you hear me now?
Yes.
I was still on mute. Sorry about that. Yes, I'm going to talk about the Tor Allowable Activities. First, I want to kind of talk about the cultural appropriate traditional practices that you can implement into your program. I know that a lot of grantees tend to do activities such as feeding, work, drumming, smudging. Those type of activities are 100% allowable, but we just ask that you try to incorporate some other things involved with the TOR program, such as treatment, recovery, or education educational things into those programs that you have. That way you can spend your TOR funding towards those special cultural events. The TOR grant mostly focuses on prevention, treatment, and recovery, as you see here. But I kind of wanted to highlight some things in reference to each one. So prevention. Most people right now are using naloxone as one of the prevention strategies, which is a life-saving medication that you can use to help with overdoses. So multiple people are using that as one option. Another prevention strategy would be education on overdose, like the signs or things to look for. That is something that you could implement into your program, education about that. And then most importantly, of course, our grant focuses on treatment, which most likely will be medicated assistant treatment, MAT, especially if you are funded with over $150,000 towards your grant, you must incorporate MAT treatment. We also support harm reduction, such what we noted on the screen here, just highlighting that we do not allow syringe purchases. That's one thing that's just not allowable, but everything else, fentanyl testing strips, naloxone, education, and everything else is allowable. Go to the next slide. Okay, other expectations. I know we have a lot of expectations under the TOR grant, but just to name a couple of things here, as you can see. One of our major things is SAMHSA strongly encourages all recipients to adapt a tobacco-free environment and to promote abstinence, except for, again, if it's tribal related, if it's something that's a traditional practice that is acceptable. Other than that, a tobacco-free environment. We also ask that recipients are expected to facilitate health insurance applications and help enroll eligible clients into programs if they're eligible. And then recipients should also consider other systems for which potential services recipients may be eligible for, such as Veterans Health Administration and senior services. We can go to the next slide. So I think we've talked about this a little bit before. We focus on using evidence-based practices. So SAMHSA grants all require that everything be under evidence-based practices. I know there's lots of other different types of practices out there, but those are the ones that we only allow for this grant. So it has to be one of the allowable ones. You can also check out this website that's listed on the site here below, or the NIH website, to see if there's other ones that you might want to use that are approvable. Or also speak to us when your GPO is going to call if there's any questions about that. You can go to the next. So your funding limitations. So up to a combination of 25% of the total grant award may be used for developing a collection of performance assessments and infrastructure development, such as probably helping with your FAR collections for data purposes for the Gipra data. Again, we only allow FDA-approved products to be purchased under TOR grant funding. And then if you have more questions, definitely look into your FO at the bottom here. It's in your Appendix H. You can go to the next slide. Last but not least for me, I'm going to talk about the program performance report. So grantees are required to submit a progress report update at the mid-year of the grant. The first progress update should be in the first 6 months, and that's due April 30th, 2022. So along the way, we're going to have calls with you all probably once a month or bi-monthly to discuss your updates. So all you have to do is kind of gather that information and put that in your report for the mid-year. This performance progress report is required on an annual basis and must be submitted no longer than 90 days after the end of the period of the grant, which would be December 30th, 2021 in ERA. This due date is stated in the notice of award. So reach out to us if you have any other questions. Now I think I'm going to be turning things over to Paul.
Thanks, Brittany. So this next slide, the role of the government project officer, just kind of an overview. I think the most important one here is the second one, supporting grantees to achieve successful outcomes. And, we really want to be a resource for you to help you to achieve success and accomplish as much as you can with these grant dollars. So we're in constant contact with you, regular calls. Obviously, you can contact us at any time via call or email. And then we also have the responsibility of making sure you're kind of sticking with your plan, and that what you're doing is allowable, and that you're on target in terms of any report requirements and the timelines for those. Okay, next one. Okay, important grant documents. I think you're all pretty familiar with these. The FOIA is important just because it contains those requirements and restrictions like the ones Brittany was just talking about. The approved grant application, again, that's kind of that you provided most of the information there, so it's kind of the outline for us to follow, for all of us to follow. Changes can be made. Obviously, things come up, conditions change. COVID obviously is a big recent example of that, and a lot of grantees have had to modify their grants, and that's fine. Just make sure you talk with your GPO about what you want to do, and we'll try and work with you to do whatever we can. And then lastly, the notice of award also contains some of the deadlines and requirements of different forms that you have to hand in, fill out, and submit it through ERA. And we have the disparity impact statement listed here because that's one I think all new grantees have and will have to get in by the end of this month. Okay, Gipra. Okay, so Gipra stands for the Government Performance and Results Act, which was an act that was passed in 1993 and then updated in 2010. And basically, we don't do all this just to give you a headache. This is part of a process every agency has to go through, where they submit annual performance plans and performance reports. And in the case of SAMHSA, for grant programs, we need to be able to track the progress that we're making and to show the effectiveness of the grant programs. Just in case anyone out there decides to scrutinize the program, we want to make sure that it is being used effectively, so it can continue to be here, continue to be reauthorized in the future going forward. All right, next one. Gipra data requirements. So that the two main areas right now are the grantees purchasing, distributing naloxone kits, required to report the number of kits purchased and distributed on a quarterly basis. That's fairly straightforward. The other thing, the client level instrument we hear more about is where grantees are providing individual client level treatment or recovery services will be required to collect client level data on elements including but not limited to diagnosis, demographics, substance use, services received, types of MAT, etc. Again, this is to show that the program and the strategies you're employing and the programs you're executing are being effective. And yes, it is time consuming to do the individual client level questionnaires and surveys, and then enter them into SPARs. But again, that's kind of where we are now. I think you'll see changes in some of this over the next couple of years, but for right now, we got to comply with the law, and again, protect this program from any scrutiny and make sure it's here in the years ahead. All right, next. Oh yeah, just a little more detail on the client level surveys. Client level data collection is required at baseline when they come into services during intake, a 6-month follow-up, and then a final set of data upon discharge. Again, to hopefully show that the clients we're serving are getting into treatment, getting into recovery, staying in recovery, having good outcomes because of these programs. And then there's some information here about being provided access to SPARS if you don't have that already. I think the important thing here is the SPARS help desk email recently changed due to new contractors, so make note of that if you need to email the SPARS help desk. Okay, so this is kind of the what, how, and when. Discussing specific data collection requirements for the grant applications to determine Gipra targets, reviewing the Gipra data collection tools and associated documents. It's a good way to get more background and become more familiar with the process, and then begin collecting and entering required information as soon as possible. And then, like with everything, if you have any questions or concern, please discuss this with your GPO. And kind of going back to the second thing there, when it goes to the next slide, importantly, we have a introduction to Gipra data collection tool and SPARS on Tuesday, November 9th from 2 p.m. to 3:30 Eastern Standard Time. So that'll be a good opportunity to do more of a deep dive into Gipra, its requirements, the type of data collected, and how to input it into the system. And I think the next slide is just our contact information for the three of us here, the three GPOs, and you should probably have that already as well for your own GPO. But if you can't get in touch with yours for some reason, feel free to contact any one of us. We'll do what we can to help. All right, questions?
So, let's see. I guess if the operator could help us out here. I know if you have questions at this point, you can enter them in the chat. I believe you can also press. Let's see.
Hello. If you do
is.
have a question, please press *1 on your phone. Please make sure that your phone is unmuted and state your name clearly when prompted. Again, that is *1 on your phone. If you would like to enter in a question to the chat, please make sure that you address it to all panelists. One moment. Our first question comes from Michelle Weaver. Ma'am, your line is open.
Thank you. My question is about the Gipra data. I know that we have the training in a couple weeks, but I figured I would just take the opportunity to ask. I am a Tor grantee, and our first grant started in 2018. So in the last couple weeks, we've received a few intake Gipra datas, but when I went in to put those in, it wouldn't let me because according to SPARS, that grant period ended. So I already contacted SPARS, and I'm waiting for their help, but I just wasn't sure if you guys have ran into this situation before and how you would suggest or what to do in a situation where your grant period ends and now you're in a new grant period. Thank you.
Yeah, thank you, Michelle. It's a great question. So if you collected those Gipras, and if that was data collected during that last grant year, just let us know and we can reopen that grant to make sure you get all that in and it counts towards that grant. But if they were done under this new grant, just in the past 2 weeks or so, we haven't yet gotten you all set up in SPARS on the new grant. So that's the issue there, and we plan to do that by next week sometime. So, but I think in order to do that, like Paul mentioned, we just have to have you fill out a form and get your current SPARS account connected with your new grant. So there's just a simple process there. But if you've already started collecting Gipra data, just hold on to it, and we'll have you set up to upload it into SPARS soon.
Thank you. Our next question comes from Danny Dio. Your line is open.
Hi, I'm Tammy Dio for the Seneca Nation. I do actually have another question regarding the SPARs and the Gipra. We were TOR 2018 as well, and my question is, going forward, we have active participants now that have done the initial. Some of them have done a 6-month. Some people have come back around and done another initial. If we're proceeding forward with this new grant, are we collecting the initial Gipra from anybody brand new? Do we start all over? Do we do a 6-month for the people that we did the last TOR grant? So do we do a whole brand new one over for the people that we have currently?
Yeah, thank you. Another great question. So if you had a grant previously, you had some clients, maybe 20 clients, and some of those are continuing to be served in this new grant, you should complete a new intake on them under the new grant. And, to tie up the loose ends, you can also complete a discharge on the previous grant. There's a brief 1-page discharge section that you complete, and you can, indicate that I think they let you choose the reason for the discharge. But most important is, you just complete a new intake on them under your new grant using the same client ID number.
I also have another question real quick. You
Sure.
said there's a 1-page discharge Gipra. Normally what we found is like you're repeating the entire Gipra for the discharge.
So yeah, there's the follow-up where you complete the the NOM sections again, right?
Yes.
Yeah. So that's separate from the discharge, but I know we don't want to get too deep because we don't have the Gipra screenshots or anything today, but we will be going into plenty of detail on the Gipra on November 9th.
Okay.
And but yeah, and for the other part of your first question, any new clients, definitely complete an intake with them under the new grant. But yeah, if you have clients who are continuing from a previous grant, we ask you to complete a new intake with them under this new grant so you get credit for them, but you can use the same client ID number that you used before.
Okay, thank you.
Thank you.
Thank you. Again, if you would like to ask an audio question, please press *1 on your phone. And if you would like to ask a web chat question, please make sure that you address it to all panelists. One moment. At this time, I'm showing no further questions.
Okay, and there will be, more time to ask questions if any come up after our next presenters. So we have no other questions now. Making a lot of noise. Okay. Yeah, I guess if you're not speaking and you want to mute your line, makes it easier to hear. But at this point, I'm going to turn it over to Olivia Klein-Thomas, the Grants Management Specialist on the TOR grant. She's going to talk to us about some of the financial aspects of the grant. Must be having some trouble with your audio, Olivia. Getting a lot of loud feedback. Can't really hear you speaking. Okay. We need you to call in again. The admin can.
Pick up the handset. Or if you're
Olivia. Yeah, we're just getting a lot of loud feedback. We can't hear anyone speaking.
She has disconnected at this time.
Okay. We can wait a moment for her to try and call back in.
If you want, I can do my part now, Will. It's up to you.
Yeah, why don't we do that? Let's just jump ahead here. Thanks, Humberto. All right, so little change in the plans here. Humberto Carvalho is going to be talking to us about some of the training and technical assistance resources available to grantees.
Great. Thank you, Will. Good afternoon, everybody. It's a great pleasure to be here today to give you some information about the SAMHSA training and TA resources available for our grantees. So next slide, please. So if you go to the SAMHSA website on our website on the first page, you're going to see that on a second tab, we do have a tab called Practitioner Training. If you go to that tab, you're going actually to be you're going to see a portal for all training and technical assistance programs SAMHSA is currently funding. And I would invite you all to take a tour throughout this portal for whenever you have a chance, because you may find several interesting programs related to the work that you guys are going to be doing. And all these programs and TA resources, they are there to help anybody, any grantee or any provider, and any of the resources that they have is free to download. A lot of the trainings that they offer, actually all the trainings they offer are free trainings, and a lot of those trainings, they actually offer CEUs. Next slide, please. One thing that all these trainings have in common is that they all focus on evidence-based practices. So for that, SAMHSA has actually created Evidence-Based Practice Resource Center. You can find that on our website. What you see here is actually a picture of the front page of the website. It's pretty much a repository of evidence-based practice for prevention, treatment, and recovery. The committee who reviews these evidence-based practices ensure the effectiveness of this practice. So all the resource that you're going to find in this resource center, they have been vetted by SAMHSA. Most of them, if not all of them, they focus on practical implementation tools, and they are updated routinely. So I would, I would alert you to just go there once in a while to see what else new is there. Next slide, please. So the first program that I would like to talk to you about is the Technology Transfer Centers. We call it the TTC. This is a workforce development program, and the purpose of this program is to develop and strengthen the specialized behavioral health care and primary health care workforce that provides prevention, treatment, and recovery support services for substance use disorder and mental illness. The mission of this program is to help people and organizations to incorporate effective practices into substance use disorder and mental health prevention, treatment, and recovery services. Next slide, please. This program is actually comprised of three networks: the ATTC, which is the Addiction Technology Transfer Centers, the PTTC, which is the Prevention Technology Transfer Centers, and the MHTTC, which is the Mental Health Technology Transfer Centers. I usually represent these programs in a triangle because they, in one way or other, they complement each other. Next slide, please. This program is set regionally, so you do have a representation of this program in each of the HHS regions. What you see here is a map of the U.S. with the HHS regions highlighted in different colors, and you see a triangle inside of each of the regions. So what that means is that inside of each of the regions, you have one ATTC, one PTTC, and one MHTTC that serves the states within that region. So each network also has one coordinating office, one office that is focused on American Indian and Alaska Natives and the population, and another office focused on Hispanic and Latino population. So altogether, there are like 39 centers throughout the entire U.S. And I'm going to give you a little more information on how you can access the center that serves your state. Next slide, please. So this is just a quick representation to let you know where these centers are housed. As you can see here, in each of the regions, you see most of the ATTCs, the PTTCs, and MHTTCs, they are housed within universities. Some of them are housed within some national organizations, and the coordinating offices in the two national focus areas, they are housed also in universities. You know, in the case of the American Indian Alaska Native ATTC, PTTC, and MHTTC, all three of them are housed within Iowa State, Iowa University. Next slide, please. So one thing that these centers have in common is their website have the same backbone. So they are always different within the content that they present, but they all have the same backbone. So if you enter this website, it's very easy because it's the same structure. So what you're going to see is we're going to see a tab where you can find your center. That tab usually has a geolocator that immediately is going to tell you the center that serves your state, depending where you are. You also have an education tab, which is where you're going to find training and events, and that's also where you're going to find a platform that we call Health in Knowledge. That's where you're going to find all the self-paced online trainings that the TTCs have. And like I said before, most of those trainings, they do provide CUs, and all of them provide a certificate at the end of completion. So you also have a tab for resources where you can find products and a resource catalog that you can actually search for specific resources using keywords. And you also have additional tabs with specific projects under the projects and communication. Next slide, please. So the way that the TTCs deliver training and technical assistance, they use several types of modalities. So they do a lot of information dissemination, which is usually done via electronic publications, email distribution, and social media. They do a lot of learning events, which can be sometimes in-person trainings. Obviously, right now, because of COVID-19, we are not holding in-person trainings. Most of the trainings are being done virtually. They also have a lot of learning events together with conference. They do a lot of training on trainings, and they do a lot of webinars. They do virtual learning communities. They do online courses, which are instructor-led, and sometimes most of them are self-paced, but sometimes they are actually instructor-led. So they do intensive technical assistance, which is a combination of connected learning series, peer learning networks, and echo training. They do a lot of product development. If you go to their website, you're going to see a lot of assessment tools, curriculum, mobile apps, multimedia resource, and slide sets. And everything in their website you can download. You do not need to ask permission. You can download and use. They also do consultations and technical assistance. Most of the time, those consultations in TA are virtual, but in some occasions they can actually do it in person. Next slide, please. This is just a quick example here. This is what the website looks like if you haven't seen it before. This is the front page of the ATTC website, the Addiction Technology Center. As I said to you, you have the first tab there, your ATTC. Because I am in Maryland, so my center, you see that your center is Central East ATTC. So just because I am on the Central East ATTC, it does not mean that I cannot enter the other centers and see what kind of resources they are developed in a different region. And I have highlighted in red over there the National American Indian Alaska Native ATTC. That's where you enter to the specific training NTA Center for American Indian Alaska Native populations. The education tab, like I said, that's where you're going to find the Healthy Knowledge platform. That's where you go to find all the trainings that you can take on your own time. Also, I would recommend, if you look at the bottom there, get connected, get informed, get trained. If you navigate through this website, you are able to register with the centers for your region and also with the Native American and Alaska Native ATTC in order for you to receive their newsletters and information from the specific events that they develop that may be of your interest. So I highly recommend that all of you sign up with your regional center and also the American Indian and Alaska Native TTC Center. Next slide, please. Accessing resource and training TA. So if you go to the resource tab, like I mentioned, there's a product and resource catalog, and when you click there, what you see is what you see on this slide, that you have like a search feature there where you can enter, for instance, in the case here, I've typed hepatitis. I was looking for resources related to hepatitis. And when you type there, you click apply, and a list of all resources are going to come up. So you can actually search for all types of different subjects there. This was just a quick example. So next slide, please. So another example of some resources that they have some platforms within the website, especially within the main website, that, for instance, they are pretty much focused on opioid misuse. There's this first tab that we call Taking Action to Address Opioid Misuse. That's a platform where you can find a lot of resource trainings, webinars, everything related to opioid misuse. Same thing for focus on stimulant misuse, building telehealth capacity, the health in knowledge, and COVID-19. So if you go to those specific tabs, these are represented on our website as a carousel. When you go to their website, the main carousel, if you can flip the carousel, you're going to be offered options to enter all these type of different page that will give you quick access to all these specific resources. Next slide, please. And this here is just a quick representation of each of the American Indian Alaska Native ATTC, NHTTC, and PTTC websites. Again, I would recommend that you all register with their website so that you can receive the individual newsletters for all these three different programs. Even though the three of them sit within Iowa, University of Iowa, you need to register with all of them in order to receive all the different materials. And you can see on their website, they will show you the upcoming events, products that they have developed, and any interesting information that are related to products and activities that they are implementing. Next slide, please. So here is some American Indian Alaska Native TTC helpful resource. For instance, they have an alcohol and drug exam preparation resource. That's where you enter. You can actually access modules for preparation for the exam. There is a Tor technical assistance webinars. They all have been stored. You are all part of the Tor group, the Tribal Opioid Response. So, there's a specific tab, Tribal Opioid Response, with specific resources that have been gathered since the beginning of this program that are housed there for any provider under this program to access. There is also Transforming Tribal Communities. Is a platform with resources that are very interesting and available for anybody to use. Building cultural strengths and searching for helpful literature so related to American Indian Alaska Native behavioral health. So these are just examples of types of platforms that you're going to find inside of this website. Next slide, please. So there's also, we have specific support for the Tor grantees. So if you go under, for instance, the American Indian Alaska Native TTC, ATTC, you're going to see when you enter that program, you're going to see this gray tab, gray bar. So on the side of the gray bar, you see there Tribal Opioid Resources. That's where you go to find all the resources related that were designed specifically for the Tor grantees. And if you have any question about this training and technical assistance, you can contact Jeff Ledolter, who is from Iowa University, and he will connect you with the resource you're looking for. Next slide, please. So these are the specific resources that, all these that I presented are specific resources from the Technology Transfer Center. But however, SAMHSA has other programs that have interesting resources that may be of your interest. And I'm just going to go very quickly to show you some of these programs. Next slide, please. One of them is the Opioid Response Network. So the ORN, we call it, it has consultants located in all 50 states and 9 territories throughout the United States. This program was pretty much designed to respond to local needs by providing free educational resources and training to states, communities, and individuals in the prevention, treatment, and recovery of opioid use disorders and stimulant use disorders. This program is accessible to all members of the communities. You do not need to be provider in order to access this. You can go to their website, which is what you see here, and there's a submit a request, which is that tab on the top right. You can write a request there, and the representative from your state will contact you and ask you what kind of support you need, and they will design specific TA for your needs. So this is a very interesting, customized TA resource that you have. So I encourage you, if you have any specific need, for you to talk to your GPO and make sure that it's something that the ORN can do, but contact the ORN and talk to them. And also explore their website, because I know this is very small here in the screen, but if you look on the bottom right, you're going to see lots of events and news and activities that they also promote. Next slide, please. The second program that SAMHSA funds that is also very interesting, Center of Excellence for Protect Health Information. Okay, we call the COE-PHI. This program pretty much develops and disseminates resource, training, and technical assistance for states, healthcare providers, school administrators, and individuals and families to improve understanding and application of federal privacy laws and regulations, including FERPA, HIPAA, 42 CFR Part 2, when providing and receiving treatment for substance use disorders and mental illness. So this is a very interesting center that also provides one-on-one consultation. If you have any questions related to privacy laws or any privacy issues, you can contact them and they will look at your case and they will discuss with you and provide information. They do not provide legal consultation. They only interpret how those laws and regulations apply, and they look at your situation and they will help you understand how those regulations apply to you. Next slide, please. See, the next program that I would like to just highlight is the Providers Clinical Support System for Medication-Assisted Treatment, the CSS MAP. I know that several of you are going to be working on implementing MAT. The PCSS purpose is to expand the number of the Drug Addiction Treatment Act Data 2000 ways providers to increase understanding and the importance of medication-assisted treatment and ultimately increasing access to MAT through expanded prescribing our FDA-approved medications for the treatment of opioid use disorders. This program, if you go to the tab there, you see the picture there that says education and training. This program has over 800 different types of trainings that anybody can take. You can register, take trainings there for free. A lot of those trainings also provide CUs, and they have a wealth of information here. Some of the trainings are longer, some of the trainings are shorter. You can search through their catalog and see what can be useful for you. This is a very important program that's available for you. Next slide, please. I think that's pretty much it. So again, this is just a sample of some of the programs that we have that are available for you. And if you have any questions, I'll be more than happy to answer.
Again, if you would like to ask a question, please press *1 on your phone. Please ensure that your phone is unmuted and state your name clearly when prompted. Again, that is *1. If you wish to ask a question on the web, please make sure that you identify it and post it to all presenters. One moment. I am showing no questions at this time.
Thank you. If you have any questions in the future, you can contact your GPO or you can email me directly. You have my information on the slide. And thank you again for your participation today.
Thank you, Humberto. And I know if you've had a Tor grant before, then you are probably familiar with American Indian Alaska Native Technology Transfer Center and the folks there from the University of Iowa. They help us, a great deal with their webinars, and they've been helping us with virtual regional meetings. So if you're new to Tor, you will definitely get to know them and their team. So let's see.
Hello?
Hi there. Is that Olivia?
Yes.
Great. Let's just jump back to your slides. Sorry, everyone. Here we go. Okay. Now I'm going to turn it over to Olivia Klein-Thomas.
Thank you, Will. I hope everyone can hear me clearly now. My name is Olivia Klein-Thomas. I work in SAMHSA's Office of Financial Resources, Division of Grants Management. Next slide. Okay, in this portion of the webinar, we'll be covering SAMHSA contacts, notice of award, recipient roles and responsibilities, payment management system, financial reporting requirements, post-award amendments, and ERA comments. Next. Your government project officer and your grants management specialist are the two individuals you should contact should you have any issues or items that need to be discussed regarding your grant. For assistance with programmatic issues related to your Tor award, please contact your government project officer. And for assistance with your financial or budgetary issues, feel free to reach out to your grants management specialist. To locate your assigned GPO or GMS, you have two options. You can either refer to the last page of your notice of award, or if you don't have your notice of award handy, you can go to ERA comments. Next slide. All you have to do is go to the status menu in the ERA Commons, and you will find a real-time, up-to-date assignment of your GMS and GPO. Next. The Notice of Award is the legal document issued to notify the grant recipient that an award has been made and that funds may be requested from the designated HHS payment system. The Notice of Award is issued for the initial budget period and for most post-award amendments. The Notice of Award document is sent electronically via email to the business official listed on the award. The following link will take you to a sample Notice of Award to view as a reference if you'd like to see a sample, and I'm sure you've all received one. Next slide. Your Notice of Award highlights several important details and useful information, and I recommend you get very familiar with it. I won't read the entire list because of time, but you should pay close attention to Section 2's payment hotline information. This is where you'll find information about accessing your award funds in PMS, the terms and conditions component in Section 3, which basically just explains the general laws and regulations that govern the award, and then the special terms and conditions in Section 4, which includes special program-specific and grants management terms and conditions that must be addressed by you during the award. It also includes important dates and deadlines that you should be aware of. Next slide. The Authorized Organization Rep, or AOR, is the person authorized to sign the grant application as the official representative of the applicant organization and to act on behalf of the applicant and assume the obligations imposed by the federal laws, regulations, requirements, and conditions that apply to the grant application or awards, including the fiduciary authority responsibility. The project director, as mentioned earlier, is the individual who provides daily oversight of the grant, including fiscal and personnel management, community relations, implementation, and evaluation. The business official is the individual identified in the application as being the primary party responsible for overseeing the financial aspects of the grant. Next. Grant payments are managed through the Program Support Center Payment Management System, which is a separate federal entity from SAMHSA. The Payment Management System is a centralized grants payment and cash management system operated and developed by PSC as a secure online grants payment platform, which provides awarding agency and grant recipient customers with efficient grant and grant-like payments, cash management, and personal grant accounting support services. Recipients that are not on restricted status may make electronic fund transfer payments, requests as often as needed. However, drawn funds must be expended within 3 business days. Next. Here are some useful PMS resources. They include a user guide to help you navigate the PMS system, access to a library of taped trainings, PMS roles and responsibilities, and much more. And lastly, everyone is assigned a PMS liaison accountant. This link will help you find the one that's assigned to you. Next. The process for submitting the annual FFR has changed. Effective January 1st of this year, FFRs are now submitted in the payment management system instead of ERA Commons. PMS will then upload FFRs received in the ERA Commons system for the same validation process as before to be completed by your GMS. The annual FFR is due to payment management within 90 days after the end of each budget period. This means for first-year grant recipients, such as yourselves, the due date will be December 30th, 2022. Next. PMS will be giving a series of trainings on how to submit your FFRs through their system. Registration for training on how to submit a FFR via PMS and additional guidance can be located via the links on the slide, which will take you to their website. If you are the recipient or recipient staff responsible for FFR submission and don't already have an account with PMS, please contact PMS to get access using this hyperlink provided here. Next. Okay, the Federal Cash Transaction Report, or FCTR, is utilized by the HHS Division of Payment Management Services, which administers the payment management system. Recipients use the FCTR to report award-specific cumulative cash outlays of payments. FCTR reports are due to PMS, not SAMHSA, within 30 days after each calendar quarter. Be sure to submit your FCTR on time. If PMS does not receive your report by the due date, funds may not be released until the report is completed, meaning that there may be a hold placed on your account, and that goes with most reports that are due to the PMS system. Additional information on the FCTR is available at the PMS homepage listed here. Next. Recipients must conduct and submit a single or program-specific audit conducted for that year if they expend $750,000 or more in total federal funds during the recipient's first year per 45 CFR Part 75 Subpart F. The audits must be submitted to the Federal Audit Clearinghouse either within 30 days after receipt or 9 months after the end of the fiscal year, whichever is earlier, to the FSC website listed here. Next. As a federal grant recipient, you may need to modify your grant award or other aspects of your approved application during the year to accomplish certain program goals. This is what we call a post-award amendment or post-award action. Post-award actions requiring prior approval are exclusively processed through the ERA system, and you need to have an ERA Commons account to submit a request. So we won't be accepting any requests through the means of email or anything like that. You have to submit it through the ERA Commons system. Some post-award amendments require explicit prior approval from SAMHSA Grants Management Office before being implemented. If you don't obtain the proper prior approval, it may result in the disallowance of costs, termination of an award, or other enforcement actions. Next. Submission of an amendment application in ERA prompts the GPO and GMS to review the request and complete the corresponding checklist. During the review of a post-award action, the GPO and GMS may send a request for additional materials. We like to call that RAM for short. Communication asking for additional information about the request. Once the checklists are completed, if the request is approved, the GMS will prepare and send you an amended approved notice of award. Again, verbal authorization or authorization through email is not approval and is not binding on SAMHSA. Recipients that proceed on the basis of actions by unauthorized officials do so at their own risk, and SAMHSA is not bound by such responses. Next. Some common post-award activities that require prior approval include change in key personnel, budget revisions exceeding 25% of the total grant award or $250,000, whichever is less, change in scope, carryover, and no-cost extensions. Please visit SAMHSA's post-award amendment page for a full list of amendment types. We also have some helpful step-by-step resources on how to submit a request and what to submit in a request here. Next. Here's the link to register for ERA Commons if you haven't done so already. Questions on how to access or navigate ERA Commons should be directed to the ERA Service Desk. You can contact them during these business hours at the numbers on your screen. Next. And finally, here are some other useful grant resources you can bookmark or review at your own leisure. Next. Okay, this concludes my portion of the presentation. I will now open the floor up for questions on this section. Thank you.
So again, if you would like to ask a question, please press *1 on your phone. Please ensure that your phone is unmuted and state your name clearly when prompted. No, showing no questions at this time.
Okay, thank you.
Okay, well, Olivia, yeah, that is the end of our materials for you all today. So maybe just could ask one more time if you all have any questions about any of the things that were presented today. But, you know, if you think of something later, please feel free to email any one of us, and we'll be emailing out a copy of the slides today to everyone who presented, and we'll be posting a link to the recording in case, you know, some of your team members couldn't make it today, so they'll be able to view the webinar later on. I'll just give another minute in case anyone has any other questions. I think we left everyone speechless with our exciting material today. So, but yeah, again, please don't hesitate to email me or Brittany or Paul or Olivia with any questions that come up later. We're excited to continue to work with or begin working with all of you, and thank you for your time today. So, goodbye, everyone. Take care.
Thank you. This does conclude today's conference. You may disconnect at this time. Thank you and have a good day.